Your healthcare could be affected by a court case that's happening in British Columbia right now.
The BC government thinks that it's acceptable to put patients on wait lists for years at a time and then call that healthcare. The government then turns around and blocks these patients from paying for their own healthcare at private clinics that have existed in BC for more than 20 years. We're helping to challenge this in court.
Stories about long patient waiting lists have been a problem across Canada for years.
13 years of my life that basically I feel was kind of robbed.
When they told me I would have to wait 2 to 3 years to get into the public system for sinus surgery, I was utterly demoralized, and I broke down.
I waited 2 years to see a neurologist.
We're all just in a lineup, waiting for surgery. 9, 18 months, 2 years. I've heard worse stories than that even.
The Progressive Commonwealth Fund conducted a massive study of healthcare systems in 11 different countries. And what they found was that Canadians were most likely to wait 2 months or longer to see a specialist and over 4 months to receive surgery.
The BC government disclosed that between 2011 and 2017, more than 80% of high-priority patients were left waiting beyond the maximum medically acceptable wait times. There are some patients who need to wait almost a year for a hip replacement and patients who wait over a year for a knee replacement. And for more specialized surgeries like sinus surgery or bariatric surgery, the wait time can be up to 5 years.
What makes Canada's healthcare system unusual is that the government often bans private healthcare options. So this means that patients often have to choose between waiting a long time on a government waiting list for a procedure or leaving the province altogether and paying for private healthcare somewhere else. Now, what countries do that rank better than Canada is that they often have a choice between a public healthcare system and private healthcare options. What this does is it gives patients more choice, but at the same time, the private options take some of the pressure off of the public healthcare system.
Our court case challenges the ideology that patients shouldn't be allowed to choose how and when to access their own healthcare. Forcing patients onto long wait lists is not the same thing as providing care. In fact, it's the opposite. For many patients, long waits can extend their suffering and make their health conditions worse.
If this court case is successful, there will be more healthcare options available to patients in Canada. And more access to private healthcare options will help take some of the pressure off of the public healthcare system, just as we've seen in other countries. Ultimately, this will help patients, potentially even saving lives.
If you'd like to learn more about our case, visit yourhealthcan'twait.ca and like the Canadian Constitution Foundation on Facebook.
And to learn more about healthcare reform, you can visit our website at secondstreet.org or follow us on Facebook.